Hi, I'm Samantha Knetsch, and the modality I have to cover today is contrast baths. So the article that I chose is called A Randomized Controlled Study of Contrast Baths in Patients with Carpal Tunnel Syndrome. This study took place between July 2004 and May 2005. It was not mentioned the location that the study took place in. The investigators were Jansen, Schwartz, and Velleman. And overall, this study was level 2 evidence because they had a randomization of placement into the intervention groups, and there was a control group to compare to, but they did not have 100 participants. The purpose of the study was to find out if the modality of contrast bath was effective in reducing the hand volume before and after carpal tunnel release surgery. So, inclusion criteria was a diagnosis of carpal tunnel syndrome that were going to be getting surgery, and they had to be 21 years or older. Additionally, later on, they had 8 participants drop out, and so they had 6 replacement participants that came in post carpal tunnel release surgery. So that was a little bit of a exception. The exclusion criteria was that they cannot have any concurrent hand conditions, they couldn't have any systemic or neurological conditions, and their surgery couldn't be a revision surgery of carpal tunnel. So there are 3 intervention groups. The first had contrast bath therapy, and they did exercises, which is mostly like a hand pumping while they were in the baths. And then the second group only had the baths, just still hand, and then the third only had those hand pumping exercises. And it is important to note that in our notes, we've learned that the best ratio of contrast baths is 4:1, usually 4 minutes to 1 minute, hot to cold. And they did 1:1 ratio. And they only took data once before surgery and then once following the surgery as soon as they had their staples removed. And then what they found in the study was that there were no statistically significant changes in hand volume in any of the intervention groups. So my analysis of this, we know that this study did not show promising results for contrast bath, the modality of contrast bath pre- and post-operative carpal tunnel release surgery, but I do feel like this was a very specific study in that there are ways that we could possibly see if contrast bath is an effective modality in different ways, such as if we use that 4:1 ratio that we know to be most effective, hot to cold. If they did not have a surgery, so say if we started the surgery we started the study as soon as they got their sutures removed, we could see the progression of controlling edema more than the surgery, because the surgery wasn't standardized, it wasn't normalized, so there are 6 to 8 different surgeons that performed all of these surgeries, so it wasn't a very, the swelling, the hand size could have been a factor based on the surgeon that they had and their technique. And then finally, but such as the same point is made, longitudinal study, it'd be nice to see not just 2 data points taken, it'd be nice to see how hand volume changed over a course of months post-surgery and the rate at which that changed with and without contrast bath. And then finally, the only outcome measure that they had was hand volume. So it'd be nice to know about patient comfort or patient pain or another functional measure that would that we could see the results of contrast bath in the future. And that's it.